My name is Angela Hefter, and I've been teaching for 15 years. Prior to being a teacher, I was in healthcare as a respiratory therapist for 10 years.
And Tim Klein, and I've been teaching for 14 years now, and my background is in EMT, and I was able to work on an ambulance and then also travel overseas and work with organizations such as Doctors Without Borders, doing emergency management. And then I also have a background in public health. One of the major things that we wanted the students to see is why. Not just memorizing signs and symptoms of a disease, but why the patient might acquire that disease and how the body responds to that disease. From there, we wanted the students to see how the doctor or the healthcare provider treats the patient based off how the body responded to the disease. So we didn't want them to just open up a book, memorize signs and symptoms, or just learn about diseases. We wanted them to go a little bit deeper and have an understanding of something that can tie into not just one disease, but many different diseases that they would encounter in a healthcare type setting.
The clinical component part to that is the students are in rotations 2 days a week, 3 hours a week. And when they are in rotations, they're rotating through the different areas with different healthcare providers. This gave them a very unique opportunity to take this lesson and apply it into the real world. And that is something that they learn a lot better from, is when they do have the true world experience. So that's the other aspect that we were able to bring into it.
Well, it's a 4-year program, and so they complete an application as a 8th grader or an incoming 9th grade student. So in that application, what we're looking for is, do you have an interest in this field? Is the interest coming from you, or is it coming from an outside source such as your parents? Based off their interests, we put them in the program, and then every year they have to complete an application.
We do take students that are not just Palmdale High students, they're in our district because we are the only medical program for our high school district, and we serve thousands of students in our high school district. It gets very competitive, and we're not looking for a student who's got an answer such as, I like to watch Grey's Anatomy and therefore I want to be in a hospital setting. So that's very, very important. The applications are not just reviewed by us, they are reviewed by industry. So industry people do have an opportunity to look and see what the students have an interest in, and that is something that is a very part of the criteria that we're looking at as well.